Today on the podcast, we are truly honored to have a giant in the public health space, Dr. Delanyo Dovlo. He just completed a 2-term as faculty chair public health at the Ghana College of Physicians and Surgeons in January 2024. Prior to this, he served as Director of Health Systems and Services at the WHO Africa Regional Office. I can go on and on and on. He has a very remarkable CV. Right here in Ghana, he was a Director of Human Resources in our Ministry of Health and actually paved the way or led a team to setting up our Ghana Health Service. Not just that, also led the WHO in Rwanda as the WHO country rep in Rwanda, and he's had vast experience and contributed significantly, not just to Ghana's health system, Africa, and then globally as well. It's a singular honor to welcome on the show today Dr. Delanyo Dovlo. Wow. It's really an honor to welcome you to this podcast as our first guest. I was looking at your CV and you've truly walked the path from hospital level management to the African region, globally, you've truly walked the path. How does it feel? 40 years plus of healthcare leadership.
Well, it really creeps up on you. And sometimes it feels like all this started just yesterday. But it's an exhilarating journey. Working at all these levels, it creates a certain education for all that you do that I wouldn't miss any of those steps for anything. But yes, it's been a very interesting 40 plus years.
So as you went through the process, let's go back. Was there any significant moment, any aha moments that changed your way of thinking as a public health physician?
I would say there have been several such moments, not just one. Perhaps the initial critical one was out of medical school, I thought I'd just be a physician specialist. I never did like surgery or the sciences related to that. But it was whilst working at a district hospital in Axim that the notion of public health came clear to me when I saw what the population was going through. I spent time in pediatrics in the Fianquanta Hospital, and in those days, the period of December to maybe March was a period of great childhood mortality because of measles. Okay. And I was the only medical officer on the children's ward at that time. And so sometimes I spent 24 hours just trying to keep these children alive. And the idea that a vaccination or other measures could prevent this became very strong to me. And when I got to district level, that was even more reinforced. And that's why I changed my orientation to becoming a public health doctor. At the time, the fashionable thing was to become a great physician that people bowed to, but public health stole my heart.
Okay. So, let's look at, as you went through all these processes, do you think one level prepares you for the next level? For instance, when you were at Axim, the experiences you had there, did it prepare you for the district level leadership? Did that one also prepare you for the regional level? Do we necessarily have to go through the stages, or one can just start from hospital level and shoot probably straight to the global level?
I think we all have different capabilities, and sometimes some people are able to absorb certain experiences from other people and rise through levels easily. For me, I thought having those experiences of different levels of the care has been particularly critical. You understood what was happening at every level of the system. And that really means that when you are at the top level and taking a decision relating to a district or even a health sector, you almost understood quite clearly what the impact will be, what they did over there, and what your decisions would mean to them. And so that was particularly important. One feedback I received from one of my mentors, the late Dr. Debo, was he used to say, you talk differently because you experience all these different levels of care. And I think even if you're the most brilliant of persons, it's important to have, whether even for a few weeks, this experience is as part of your growing up.
Okay. And then along the line, were there significant challenges that I know it wasn't all rosy? Like today, we are sitting here looking back and, excited about the whole journey, but I'm sure there were significant challenges that you had, along the line. Can you highlight a few of them?
Oh, yes. I think, in a sense, some of these challenges are pretty basic and sometimes they still remain. Let's say transportation. I mean, we had a decrepit ambulance at the Axim hospital that served us to load our supplies from the regional medical stores, to carry patients back and forth, about everything. It just a lot of these things just didn't exist. We had electricity in those days about 4 hours in the evening, and we had a standby generator that broke down quite regularly, and so that was also a challenge. And these are around the working of the houses. Perhaps the greatest one, I feel, was the understanding and awareness of the population about health issues.
Okay.
That always is the biggest challenge. And I think it still exists today, getting people to understand and appreciate what we can do for them. And maybe ourselves also to understand and appreciate what we could do for them.
Okay. How about in terms of colleagues that you were working with, and was there any challenge with that aspect as a leader?
Yes, it's part of the fabric. I mean, if you didn't have people you didn't like or who didn't like you, I think it wouldn't quite be the same. And if you are a leader in a situation where everybody seems to be comfortable with you, like every decision you took and so on, I would step back and try and ask a few questions about, is there something wrong? Am I being so oppressive that they're unable to tell you things that they ought to tell you? And so, yes, that was there, not only within the staff. There were also the stakeholders within the community in various levels, national level, district level, you name it, international level, that would always have certain interests that might not be immediately visible, and you have to navigate your way through all that. So yes, there were major challenges.
But how would you also describe your leadership style as a person?
Yes, that's an interesting question. And I know people usually expect one answer, that maybe I'm dictatorial, I'm how do they call it? The friendly type and so on. But the way I see it is that I evolved through the system.
Okay.
I was much younger. I don't think I was even 30 when I was heading the hospital in Axim. Things looked simpler to me around solving problems, and I quite easily frustrated when things didn't change. So I was much more brash, much more, shall I say, aggressive to people who are not meeting the targets that I thought should easily be met. As I grew through the system and at various levels, I of course, all of us, as you grow older, you get milder.
I was going to actually ask, that is it really true? There's that milder, older, you tend to be calmer, the way you approach.
No question about it. When I look at myself now, people come and say, oh, you are such a soft gentleman and so on. And clearly some of those who know me, I have a colleague who lives in Tamale now. We work in the ministry. Anytime he sees me being gentle and soft, he says, hey, you've changed. And occasionally when the other side also comes out, he says, it's still the same old person. So in a sense, for me, I don't think I had one style of management.
Okay.
It evolved. And I also believe that in certain circumstances, you have to be the hard man. In other circumstances, you have to be the soft, diplomatic negotiator. The key thing is getting your results.
Okay. Let's move now to using evidence in public health. I mean, you've contributed significantly to health policies here in Ghana and at the WHO level as well. What role do you think evidence plays significantly in policy?
I think evidence is extremely important, though I'm going to be a bit contrarian about it, because I grew up in a system where the evidence didn't quite, should I say, exist. We're evolving as we went along, and nobody had really studied different parts of the system, or the way the studies were done were more about the disease situation, causation, and so on, but not how the population responded and how we can work on that. To some extent, I also felt that the issue of evidence was used to frustrate new ways of thinking.
Okay.
Yes. So, in a way, I thought one of the things we should do is to build evidence as we go along.
Okay.
You start something, you dialogue with friends, you brainstorm about things, you look at various experiences, and then you started something and make sure you're monitoring and somebody else researching it. I think that was the most important way we used evidence.
Okay. You contributed significantly to the setting up of Ghana Health Service. At that time, I mean, prior to that, you were the Director of Human Resources at the Ministry of Health. While setting up the Ghana Health Service, how did you ensure that politics, I know politics plays a big role in some of these things that we do, but how did you ensure that politics didn't necessarily interfere in the whole process of setting up the service?
I think it's very interesting. I see a very dramatic difference between how politics works nowadays. It's partisan nature. And in, let's say, 92, 95, when we're evolving the Ghana Health Service, the president was Rawlings. Yes, these two parties were still in existence and so on. But as a technician, I didn't feel that heavy pull of partisanship. I think the cabinet, I remember we went with one of our ministers, Dr. Buckman, to meet the social sector cabinet led by then Vice President Mills at one point. They wanted the technical input, and it was difficult to see people asking for, oh, this will affect us politically or things like that at that time. So I would say it wasn't too heavy.
So I mean, what you're saying, you think now it's...
Oh, no question. Now I think a lot has changed. Maybe it's just stories I hear and so on. All of a sudden, government changes and a lot of people at the top are changing or things like that. Not only at the very top, but more or less way down. That didn't happen at our time. I mean, we knew what the political inclinations of various directors and people like that are, but
it didn't necessarily interfere in the work.
Not at all. So long as they are doing their job and they are technically astute, I didn't feel that there was that sort of pressure to be political or to be aligned one way or other. Maybe people did it, but that was not important in keeping your position if you were performing. Yeah.
Let's move back to the experiences you've had, especially at the global stage. I mean, you've consulted for so many development agencies, UNICEF, the WHO, several of them. How easy is it for you to translate the experiences at this level to the local context?
I think that's the most important skill that a consultant should have. And I also think that the difficulty with that is what has frustrated development moving forward. Because especially if you are unable to do that, then you come with preset ideas. And of course, as soon as you leave, things don't follow. And I'm not saying that wherever I consulted, things worked out smoothly. No, it didn't. One example I had was in Namibia, where I helped develop a management development program. I was really pleased by the fact that when I was leaving, they decided to continue with it. In fact, I was invited a couple of times to go back and see what was happening. They retuned it. The ministry started paying for it themselves. But there are also several places where you go and afterwards, it's all gone. I think the key point I would like to make here is that we know there are all sort of interests, influences, and so on in any health system. And what's particularly important is to understand that. I've also been in countries where after all the discussion, debate, advice, and so on, maybe the last day you're going before you realize that it's all useless because you didn't quite understand the power play behind everything.
Okay. You've also had so many publications. I mean, as a young person being trained as a public health physician, I'm looking at all these publications and I'm like, when shall I? What's that golden advice you give to young researchers coming up in looking at working on papers that go a long way to affect policy?
I think, let me tell a story about how this happened. I had the same sort of frustrations that you had. Would write things out and they would say, oh, this is not fit for our journal. You get all sorts of frustrations. Nobody knew your name anywhere and so on. So I had worked on, because I was director of human resources, one of my interests was the way we're losing doctors to the diaspora. So we had worked on, we'd taken some data, worked through it, wrote a sort of casual paper that was circulating around. And I attended a meeting in the Philippines.
Okay.
It was about South Africa. They had just become free and they were looking for some human resource advice towards primary health care. And Minister Buckman sent me to that meeting. And I met a Thai senior health official who said, I've seen this thing that you wrote. You know, you could shape it differently. I want to publish it in my human resource journal. I was completely confused as to what he wanted and so on and so forth. But he led me through, told me how to deal with the data, some of these things. And the strongest motivation was seeing that in print, my very first one. And since then, I haven't quite looked back. I've tried to see whether we could, and several other papers came out concerning how doctors in particular were living. We used what at that time was innovative research methods, simply asking classmates where your classmate was. And that gave us quite a lot of data about how things were. But eventually, one of the things that really strengthened this was, and something you are rather training the younger people, but working with young staffers. As I grew older, I learned they were much better with the computing systems. They were much better with researching the literature and bringing it out. They were much better with doing the statistics and the data and things like that and so on. And that was really, really helpful in some of the papers I developed.
We are actually consciously holding the hands of these young ones and pulling them along?
No, I don't think so. I think it's many people have difficulty doing this.
Why should
I think because sometimes I've seen it. I remember, was it in Rwanda, where I was interested in bringing in interns into our office because I saw this work very well in Geneva. And my staff would say, they're just going to waste our time. You know, I'm a busy. Why should I spend my time on this person? But the same person will go and come with a name of somebody who's a relative or something. So it's, for me, maybe it's cultural, a sense of why should we... But I found I benefited from something like that with a couple of mentors. And I thought, listen, and again, as I said, in the end, I thought it was so beneficial for myself. We need to get people to understand that.
Yeah.
And that's quite difficult. And people don't want to share the glory and so on. But even I came back, I remember in Rwanda, one of my interns, and I wrote a chapter in a book. She was really thrilled about it. There are a couple of others in Brazzaville that we wrote an article for a journal. There was a young lady in Ghana, the Minister of Health, that helped us publish another chapter in the book, and so on. So, in a way, it's not simply about mentoring. Of course, that's part of it, but also they help. It's not simply.
But sometimes we the younger ones, we probably also make it a little more difficult to, be helped in the process.
Oh, of course. I mean, in a way, you have to find the right sort of people. You can't just mentor everybody. Let me give you an example. When I became director in Brazzaville, we were coming to hold, I think it was during the Ebola pandemic, and we were looking at the health systems, and the meeting was held in Accra. And so I said, look, instead of the staff taking notes, let's get postgraduate students from the School of Public Health and so on to come and be the note takers. One, they will learn something. Two, they'll interact with people from the WHO for their career people. It was a disaster. They were all looking for the networking to know people. But it looks like nobody had taught them how to take notes properly. Basically, my staff had to go back and take over the writing of the things themselves and so on. And there was a big lesson in that for me, that you have to choose people carefully. Not everybody would rise to become president one day. There will be a group, and out of that one will come out. So you have to see people who are interested, who are forceful, and work with them.
Okay. And let's look at some of the situations where you actually had to lead change in very complex situations. Back to Ghana Health Service. I mean, this was something new you were starting to set up. Like, how was the experience like in terms of, were there any specific leadership roles that you think you learned during that process?
I think the big one is the stakeholder analysis and dealing with that. That was an incredible lesson around the Ghana Health Service establishment. From the politicians who had a certain interest, because there was a lot of labor unrest, and the feeling was that the Ghana Health Service, like the Ghana Education Service, would change conditions of service and everybody would be happy thereafter. But which is not quite true. There were the different professions that always fought with each other to some extent, that wanted different interests from the Ghana Health Service and so on. And then there are all those outside local government that said, look, in a decentralized system, we must have the control over the health in the district and things like that. So those were quite critical things. And that's when a tool, I think it's no longer available. It was called polymapping.
Okay.
Developed in Harvard by Michael Reich and others, that I took an interest in. I just downloaded it those days with whatever internet one would have. And what it does is you take the nurses. What would be positive for them in this? What would be negative? Why would they resist this and so on? And it actually creates a certain template for you. And so when you go into negotiations, you have a certain idea of what sort of incentives you'd give people. I found it very interesting. I remember my minister at the time, Commodore Steve Obimpe, and I sat down one time and went through it, and he was so excited by it. He wanted to work with it himself, even at his level as a minister. And it's something that we need to be doing all the time when we are working on these complex issues. Yeah, it became useful even in WHO when I took on some task over there.
Okay. So, you've highlighted some of the main things and how you navigated it and how you handled it. Let's look at another complex situation you found yourself in during the COVID era. you were actually tasked to coordinate the field hospital, UN field hospital here in Ghana. During that process as well, aside some of the issues you highlighted during the setup of the Ghana Health Service, were there any others that were significant during the process of setting up the UN
The
clinic
COVID
here
hospital.
in
Yeah.
Ghana?
Let me explain. The hospital was meant for UN staff working all over Africa to give high-level sort of treatment, because when they started, you could no longer evacuate people to the European hospital. They were overwhelmed themselves and so on. So it was a rush to set this up. And I had just retired not too long ago. And the director of, the assistant director general at HQ responsible had worked with me in Brazzaville and thought, look, if you're in Ghana, maybe you could help do this, which is another example of sometimes knowing people.
And people trusting you.
It's trusting what you do. Yeah, not simply knowing, but so I was asked to coordinate this. It also helped that I was familiar with the UN system.
Okay.
Because this was a multi-agency thing. WFP was controlling the building of the place. Various were doing this. So it was quite complicated. So that's on the UN side. On the Ghana government side, there was the Ministry of Foreign Affairs, the Attorney General's Department, of course, the Ministry of Health, with various interests and so on as to how this works out. Because at the end of the day, very expensive equipment and things like that were to revert to the government. And there were all sort of...
I can you imagine the pressure on you at that time? Because it was a very critical moment where everybody, I remember the COVID time, we're all not sure about what was going to happen next. And
oh, no question. And I'll get calls from Brazzaville or from Geneva. Why is this thing not ready? So I confess it was, I think the critical thing for me was that I was retired and didn't care too much about what effect the pressures could have on me negatively in career terms and so on. I was beyond that. But also, I was quite familiar with the UN system and could stand up to the other agencies that were trying to frustrate things. It was difficult. WHO was leading on the actual operationalization, and a very new person to WHO and to being a WR was acting in the country at that time. So she liked the fact that I was around, able to do these things at the time. So that helped. But also, all the regulatory agencies, each and every one of them related to health, we had to negotiate with around the inspections and approving the place in record time to get these things going. And sometimes in an informal way, the role I played in Ghana before, I remember going to the Nurses and Midwives Council. I said, oh, it's you. Anyway, okay, we are waiving the registration fees for all the nurses you bring in and things like that. So there are those positive things that...
Did you sharpen your negotiation skills? I mean, along the journey? Because in this particular situation, it was evident that your negotiation skills were really top-notch. How did you build that over the years?
Of course. I mean, you get experiences, you fall flat on your face on occasion, and you learn from that. I'm going to say learning from the mistakes is one of the critical ones.
Wow, what an interesting conversation we've had so far with Dr. Dovlo. We would go on a very quick break, and when we return, we'll even go deeper into some of the leadership lessons.
The Ghana College of Physicians and Surgeons is set up by an Act of Parliament, Act 833, with the mandate and function to, among other things, organize and supervise specialist training, and promote continuous professional development in medicine, surgery, and related disciplines.
Welcome back to the Ghana College of Physicians and Surgeons Leadership Podcast. And this is the very first episode we're having. And my guest has been Dr. Dovlo. We've had a very interesting discussion so far. Before the break, we started navigating some of the complex situations that, he had to lead. And it's usually said that leadership is very evident in complex or difficult situations. And it's obvious our guest today was able to navigate those difficult periods. And there are some skills that as you spoke, became very clear, like negotiation skills. How did you think, as your journey went, you were, built for this in terms of how did you work on being a good negotiator?
I must say, I'm not sure if I'm a good negotiator. There are different circumstances. Sometimes you do quite well. Other times you don't get what you wish to achieve. But I think as you go along the line, and I must emphasize this, you make mistakes. There are situations in which you fall down flat. And so you just rally and try to regain your confidence and your learn lessons from what has happened so that you anticipate the next negotiation. The other side of it is the lessons you learn from these mistakes is how to prepare, having your information available, understanding where the people across the table from you are coming from, what their interests are, and what value they bring to the table, and what distraction they might cause if they are not satisfied with what you're going on. And gradually over the years, you learn to be able to do these things. And even at the peak of your career, it's not always that you are successful. It's important to know that also.
Sometimes, even at this level, sometimes in leadership roles, there is a lot of resistance. I'm sure during these complex situations you found yourself in, there was resistance. I don't know, either from the partners or some of the actors, or how did you really handle resistance as a leader?
Resistance is it's almost a given in any situation of change, or even and sometimes being asked to take over a department is sufficient change to generate significant resistance. And it comes in different forms of people who would, say, challenge a policy decision. It will come in terms of people dragging their feet around doing something. It will come in shape, sometimes from outside your organization, simply getting what should be an administrative process, simple process going, and it's delayed, and they find ways to make sure it's not happening. So I think the first thing is to identify that it is happening and try to see why it is happening. And there have been a number of instances where this has come up. And let me give an example. When I was in Geneva, one of the roles I was asked to play was to help develop this program of national health policy strategies and plans, and strengthen country office staff as the way WHO health systems wanted to engage with countries in strengthening policies and plans as their main focus. And this was coming from an internal source of funds for training WHO staff. And so somehow my director managed to convince the then DG, Margaret Chang, that this was important and the money was going to be given and I was going to lead it. And clearly, at first I didn't think there was anything to it, but clearly some people were getting signal money to do something else, and they were asked get in line with these people. It was amazing, the resistance. It was this global all over the place. And what they did was we have 7 regional offices, and they got about 3 or 4 to resist. They even got all the deputy regional directors there. There's a meeting they go to. They came out with a scathing report about how this was useless and wouldn't work and so on.
And it still caused you not to bow, like.
No, maybe by then I was much stronger, and I think part of it was simply about who is this guy from Ghana trying to lead us on this, telling us what to do. Second was simply, the shifting resources and lack of control from those who thought they ran these things before. And some of these were very influential people, very well-known people. So what we did was to go above them.
Okay.
We spoke to the regional directors. We spoke to people who were influential, and it was amazing. Once people saw the technical value, and I always tell people I mentor that it's important that whatever you're doing, the technical value is correct. And then you can try to work on the politics and the negotiations on that. But if you're also trying to push something that's not quite it. And I remember maybe a bit of storytelling. We went into Cairo, the Eastern Mediterranean office, and it was almost virulently antagonistic. People were almost ready to walk us out of the office. This is a sham, this won't work, and so on. And the first day was filled with these things, these debates, and we kept hammering at this is what this is supposed to achieve. On the second day, towards the end, some of the most resistant persons, WR from Somalia or something, just said, I want this. When are you going to start in my country? And then suddenly around the table, everybody was like, look, no, this is fantastic. And the most aggressive, negative people now were shocked as to how people who were really, and I think misinformed the day before, suddenly thought, look, let's not follow this and so on. I always remember that vividly. And one of the people turned around to me and said, you are a magician. How did you cause this? Yesterday, these people were all very angry about this thing, and today they're. And so I would say it must be technically good with this thing. And you must have a passion for it. Otherwise.
You've highlighted the importance of knowing your stuff and you're technically good. But in recent times, in terms of leadership, there's been some highlights on emotional intelligence as well, like focusing on soft skills. Looking at the various roles you played, do you see emotional intelligence coming out clearly?
I think it's you can't do any of these things without utilizing both. For me, having the technical knowledge and understanding is simply the foundation. In order to get it through, then you need the emotional intelligence and so on. And part of it is, again, around what is in it for the person across the table. What will it take away from the person who is working on something else, and trying to minimize those negative effects and enhancing the positive ones for people. And then you get along. And also, it may seem a bit trite, but it's good to be friends with people. and simply...
It always opens doors for
you. Oh, absolutely. Absolutely. To tell another story, we went into Yemen. I've been to all sort of interesting places. And would have these formal meetings, and nothing seems to be moving. In the evening, everybody moved into a sort of after dinner party and so on. They have this mild narcotic they call cats, and so all the men sit down, and then that's why I saw all the discussions took place in a more rational way, in a more this thing, and people understood. You had the opportunity. When you are all just relaxing. In other places, Yemen is Islamic, so it's over cards. In other places, over the beer in the evening or something like that. But then at the next day, people are better willing to listen to you and what you have to say because of they've humanized you and they feel you are a friend.
Okay. Let me come back to this. Mostly, we've also been told that as a leader, it's always good to start with having the end in mind. I mean, having the bigger picture in mind. Let's go back to Dr. Dovlo in Axim as a medical doctor. Was it really easy for you at that level to picture the end in mind? I mean, looking at how you moved to the global stage.
For myself? Oh, absolutely not. I had no idea where I was going. Certainly not at that stage. It was what? Axim 3 years out of medical school. I went there in 83. I was just trying to do my best in the circumstances. I had some great friends there. For some reason, the chiefs sort of liked me and took me to heart. So I felt a reason to be engaged with them, to try and sort things out with them. I would use my own car for immunization campaigns and things like that and so on.
So, for me, you are saying you were making the most out of every situation you found yourself.
You have to, yes. It's. I think the way to.
There are no shortcuts.
No, there are no shortcuts. And I'm saying this in terms of that in Axim, I thought I was doing this to become a director in WHO. Absolutely no. I had no idea. At that time, I thought, okay, who knows? I might make a regional director one day. In those days, most regional directors were just approaching retirement. And so at that time, in my mid to late 20s, I was thinking of, okay, that's another 30 years on before I would come and do this thing. So to some extent, I would say that big picture is simply for where you are at the moment.
Okay.
I wanted a good district with this in Axim. At Takoradi Hospital, I thought, no, we could become one of the best hospitals in the Western region.
Okay.
We make quite an effort at it, and that's just it. And then the opportunities come. Well, not always that smoothly. I've applied for things where I was kicked off and sent back to where I was. And then another door opens a couple of years later, and then you move into that. Then again, you want to move on something that looks attractive, doesn't quite work out, and so on. So one of my challenges for younger folks I work with is that sometimes they get so disappointed with not doing this or that. Anytime I come into Ghana, one of the questions people want to see me, I want you to mentor me, and then they'll come and say, how do I get into WHO? How did you do it?
If I ask a question, I'll personally ask you, how did I get that?
And I didn't plan it. As my career grew, working with people from WHO and so on. And then somebody will call you one day and say, you know what, there's this position going up, and I think it will suit you. Why don't you apply? Or things like that. But if I had started off by saying, I want to work in WHO and so on, I'm not sure if I would have gotten there.
And probably you wouldn't have enjoyed the process very well in terms of learning at each level step before getting to that point.
Exactly. For me, that's the critical thing.
And let's put your experiences in Ghana and Rwanda. At a point, you were the WHO country representative for Rwanda. How was the experience in Rwanda different from Ghana?
That's a very interesting experience, and it's I think Rwanda served as one of my greatest lessons. Okay. I remember at my son of the permanent secretary for health was like, oh, I think your experience here has helped you gain the promotion to become a director of health systems in the country, which is true. They do things in a way that's different, and so on. And later became the Minister of Economics, Finance and Economics, and so on. A good friend. But it's a very different system, and it leads me to something a professor from, I think, Harvard said at one of the meetings I was in, he was talking about India. Very intelligent, very well read, these things. And he himself was of Chinese background. Says, but the difference with China is that China will say, we need to do this. And then they don't care too much about the debates and so on. They'll go ahead, do it, make mistakes, correct, and do it. In India, they'll debate things into a stalemate. And very erudite, excellent professors, and have strong views and how this would not work, or it has to work this way, and don't let it go. And to some extent, that's how I saw the difference between Ghana and in Rwanda. That in Ghana, we had an atmosphere that said everybody speaks, and all the different elements come in and so on, and trying to get something started, and especially taken to the end, can be so difficult with many things coming back and forth. In Rwanda, if they felt it was a good thing to do, they'll get it going.
Okay.
And they'll push everybody, the partners and so on, to support it. Excuse me. And you learn as you go along and evolve it. This whole sort of having every stakeholder's interest coming up and going and so on, it's much less so. They have the thorough debates and discussion, and if they feel they are going to go, they go. They don't waste time for years making things. Let me give one example again. The specialized nurses training program that we have now. Everybody forgets we didn't have theater nurses. We didn't have these things. We started it when I became director of human resources, and for years I have been going to workshops to discuss, are we going to do this, that. And when I came, one of the lessons I learned from the fellowship I'd been to in the US before coming was how to target things. So I said, well, for me, we have 6 months to get the first nurses into classrooms to start this. And that shaped Mr. Simon Koku, who is still around, who was leading this in HRD at the time.
Okay.
That shaped our focus.
Okay.
That in October, if it's 20 nurses each for the 3 programs we're starting at the time, they should be sitting in a classroom with somebody teaching them. And so we went all out to get to that point. It was a simple sort of target set out to do, but it really helped us to get there. And to avoid all there's a whole lot of backstory to that about the fights with the medical school about setting that up. So for me, it's about don't discuss until you are all frustrated. If it's a good thing, agree to learn whilst doing it, and go ahead and do it.
Okay. Let's look at Rwanda again. What would you say was that one most important leadership lesson that you learned there that we should tap in for our healthcare system here in Ghana?
Yes. The Ghana Health Service DG is always asking me about this same thing. And I would rather say 2 things.
Okay.
One is the leadership in Rwanda fosters 2 things. The major one is simply accountability.
Okay.
Whatever you are doing, you are leading, you just have to be accountable for it. The second is there's no room for apathy.
Okay.
And so with the accountability and the pressure to reach results, it is difficult for a manager to say, I don't care, I'm tired, the money hasn't come. As I've seen there, I wrote a letter to the ministry 6 months ago, they haven't responded, so I'm waiting for them. No. As a manager there, if you want to keep your job, if you want to be seen as achieving your things, you will follow up and make sure things happen. And those are the 2 things. It's a different culture. And so, but we have to sit down as Ghanaians and say, how do we hold people accountable? And how do you hold them accountable in such a way that there's no room for apathy? They would want to achieve what they are supposed to.
Before we move to probably the last part of the discussion, where we are going to look at some of the managerial skills we need as leaders, I want you to highlight on one aspect of leadership we sometimes talk about: diplomacy, the act of diplomacy. And I mean, put it side by side, sometimes being able to say no as a leader. Has it always been easy? Are there any significant times that in your journey you had to step your ground and say, for this one, it's a no?
Well, it's something that comes on a daily basis, and you begin to wonder what did it mean. It is particularly significant if the no has to be to your boss. And it's happened a couple of times that I've had to say, no, this will not work.
Are you blunt with it, or you have to advise our diplomacy?
Of course, you have to have a way to go about it. But I must also say that in my experience, you don't always have to be nice and it's all right, let me go behind the scene and let this just first, you won't get anywhere. So at times you do have to be blunt and say, this is not going to work, or I'm not going to create this. You must, of course, be aware that you have the solid backing either of your donor or your source of money or things like that, to be able to say that to people and say, no, this is not the way we conceptualize this, and so on. One example, the way the WHO works, you're at the regional office, you have more or less a similar office in the headquarters, and I was lucky I'd worked in both. And if you're not careful, the headquarters collects all the donor money, recruit staff there, but expect the action to happen in Africa. And at the end of the day, they would go back and say, oh, it's those Africans, they are useless. You can't get them to do anything, and so on. So I sort of experienced that. So when I was at this level and this thing started, luckily we had a regional director at the time who was popular with partners, and so we got visits from USAID top leadership into Brazzaville. It had never happened before. From DFID, top leadership from the Chinese. And so at that point, they came in one time and said we should sign an agreement for the HQ department that they spoke for us. And so they would channel the funds and so on and so forth. And I was clear, this one over my dead body, they should wait until I retire, because it didn't make sense that within the same organizations we should have an MOU or a contract. I could see through it immediately. I am sure they also saw through it themselves when I spoke about it. In fact, a lot of it was negotiated when I was away. So yes, I'm not saying at all that because you do negotiations and so on, you shouldn't be firm. And sometimes also it's useful to be angry.
But you have to know when to apply.
Oh, absolutely. You have to know when to apply it. People take you for granted in certain circumstances, and sometimes you have to put your foot down and say, no, I'm not going to accept this. This is not acceptable at all, and go back and think about it. We've had quite a few of these things, so no question. I think it's very important to understand that diplomacy does not mean folding over and being quiet. No, you have to fight sometimes, and sometimes quite aggressively.
Okay. Let's look at applying all these principles you've spoken about to the current situation now in our healthcare system. Mostly every visionary leader would have some foundation of strong managerial skills. Management skills. Looking at leaders now in the healthcare space, what do you think are some of the main management skills we need to have to be successful?
It's a very interesting environment I see now, and maybe I'm interpreting it wrong. I do believe that for all of us in the developing world, we are trying to build new systems. We are trying to grow things along a certain way, create new habits of management, of leadership, and of accountability. So for me, leaders must have all these skills of whether it's politics, it's negotiations, diplomacy. It's simply the basic management skills is important. But I agree that sometimes in leadership, you have to bypass, because management can be frustrating, especially when the administration says, oh, before you move one CD, you have to spend 3 months applying for it, go to parliament and so on, because it's a loan.
Yeah.
Let's
look at another aspect. Sometimes in a certain limited resource can be very, very frustrating.
Yes.
As a leader, how do you navigate, through situations where you are pushed to very, very limited resources, but then you still need to achieve the overall big picture?
No, that's, to some extent for a lot of countries, for ourselves, is the story of our lives. And one of the biggest lessons I learned, even in wealthy countries, is that resources are still limited. There's nowhere you go to that resources are endless in relation to what you want to achieve.
Okay.
And for me, in those circumstances, you look for, I hate the term, but what people call low-hanging fruits. I've tried to avoid it as much as possible. I say this because if you get those things achieved, you are more likely to get people to align with you to get these things done. If something is being achieved, than if you're looking to do big things but nothing is happening, then people get frustrated and move away. That also helps to attract the resources. If you're achieving small things in what you are doing. For me, prioritization is very important, and you need to look at it in terms of what should I do first and what should have an impact. And in certain circumstances, what will attract people to support me, and you do that. But I always say that doesn't mean you forget about everything else and do only that. You have to find a way to make sure things continue to run on other aspects that people are.
Okay. Before we wrap up, earlier on we spoke about some of the roles that mentorship plays in our healthcare system. Can you highlight practically now what should I say the older generation actively do? What should the system do to help raise the next generation of healthcare leaders? What are we not doing right?
I think it's an important question. I think that we discussed to some extent earlier the issue of mentorship and the fact that you have to identify a mentee that is appropriate, that is able to move forward. And also the fact that mentoring is not always a natural thing for everybody. So sometimes you have to develop it as a skill. And I told you that in Namibia, we actually trained a certain level of managers and followed them through over months to become mentors, to develop them.
So we should actively train.
Oh, it has to be actively done. It has to be actively done. One of our problems is that once we appoint managers and leaders in the system, we think they are no longer eligible for training. But there's a lot that they can learn also. When you are in an executive position, the way you deal with, let's say, your Ministry of Finance or your distance, are things that you can learn. It's not a classroom that's going to teach you, but at least it creates a certain framework within which you can approach these people and so on. And so for me, the mentorship is critical. And
Dr. Dovlo, before I let you go, one last question. So probably someone has been watching and it's like, wow, he actually went through all that. And I mean, how can I become like a Dr. Dovlo or even better in the next 20, 30, 40 years? What's that advice, that last advice you give any, public health specialist watching or anyone who wants to also walk the path that you have walked?
I've said bits and pieces of it in our discussions, but one, try to become a good Dr. Buckman or Dr. Volker or something like that. Not necessarily that man in front of. We all have flaws. But I have a list of things I always tell myself. One, I think we talked a lot about having the technical knowledge of what you do. When I led health systems, I learned to understand pharmacy. I learned to understand laboratory services and what it means and things like that. And have a working knowledge of those. It helps you lead people who work under you and guide them. Secondly, I think your integrity must be impeccable. People will work with you and accept your leadership if they know you are honest, you have integrity, you are fair in how you deal with people and the things you do. It's important. Thirdly, I think it's important to have a certain level of compassion. It wasn't quite so when I was younger. Sometimes we don't know for our staff or the people we work with what is happening at home. Whether there's a disabled child or something like that. And sometimes appreciating that and learning to understand what drives people can make you such a fantastic leader. And being able to understand that and help the people that you lead out of sometimes even personal difficulties and helping them to engage themselves is going to be critically important. There are a few more, but the final one I would say is that sometimes also you have to be ruthless. And
Don't forget that.
Absolutely. If somebody or something is an obstacle to the greater good, you can't keep just tolerating it sometimes.
Dr. Dovlo, thank you so much.
Thank you very much.
Being our very first guest on the Leadership Podcast. It's been such an insightful discussion. And I hope that as you watched us, it's pushed you to critically reflect on your own leadership journey and then pick some, tips here and there. And I hope you've learned a lot from this episode. Don't miss the next episode. Signing out, I'm Dr. Grace Buckman. It's bye for now.